Today we have Oliver Vovchenko, who's a PhD student with the New Zealand Policy Research Institute at the Auckland University of Technology. He is interested in causal inference and applying data science and econometric methods to policy evaluation problems. It's great to hear from you today, Oliver. I'll hand it over to you at that point.
Thanks, Martin. And thanks everyone for being here. Thanks for your interest in my research. So, as Martin mentioned, I'm Ollie, and I'm also, in addition to that introduction, I spent 7 years at King Order until last month. So I am interested in policy, housing policy, and in particular how it relates to individual outcomes, and in particular outcomes for children. So. And that's where this research sits. So the research I'd like to talk to you about today is about the association between housing allowance and children's wellbeing in New Zealand. This research is completed as part of my PhD thesis, and it's supported and with participation with my supervisors, so Kabir Dasgupta and Alexander Plum. So I'll start off with some, so this is just a brief IDI disclaimer. I think everyone on the call is probably familiar. This audience is very familiar with the IDI is and what these disclaimers are about. So I'll just move swiftly along. So we start our research with this premise that neighbourhoods matter for children's well-being. So children in some neighbourhoods have a much higher chance of thriving than in others. Across the world and in Aotearoa, New Zealand, where a child grows up is a key predictor of their adult outcomes. So these outcomes are shaped by things like school quality, access to healthcare, safety and community resources, and all of these are actually determined by neighbourhood deprivation around those neighbourhoods that they live in. And we have the evidence for this relationship. On the screen, you'll see this is just a simple regression using the 2018 census, assessing the association between the deprivation decile and two social outcomes for children, criminal justice interactions and offending, and all cause hospitalizations. So what we find is a steep and monotonic gradient. So as deprivation decreases, and here it's plotted from high deprivation to low deprivation, and the reference group for here is deprivation 10. So we'll compare everything against the highest deprivation and deprivation level 10. Outcomes improve systematically across the board. But the relationship actually exists for other outcomes as well, like school completions or university entrance. We see the same pattern. Children in less deprived areas do markedly better. And these changes aren't random, they're linear, they are persistent, and they are significant. So these gradients suggest that even a modest improvement in local area conditions could generate meaningful gains in outcomes. Neighbourhoods, however, aren't just a result of geography. Many people do not choose where they live freely. So these two choices are shaped by government policy. And in New Zealand, we have two main government policies that shape such choices. So the first is the Accommodation Supplement. So that's our housing allowance. The main feature of this housing allowance that it allows for greater choice of neighbourhoods. So people can choose where they live. The second is social housing. Social housing presents as of one that limits choice. Social housing in this country is mostly in areas of higher deprivation, and it's also government allocated. So there's an element of scarcity to do with social housing. That's the key distinction between the two housing policies in New Zealand. So AS allows recipients to more mobility, so move to where they like. Well, that's not true. and social housing does not. Clearly, AS recipients compete with market renters and are therefore more likely to face higher competition for houses and higher rental increases relative to social housing tenants. Just a brief introduction of housing allowances in our specific one in New Zealand, so accommodation supplement. Demand side subsidies paid to low-income families, and really their intention from the start is to enable families to access better neighbourhoods. The introduction of AS in New Zealand really tried to improve equity. Try to improve equity for low-income people. So, but there have been criticisms of the policy as simply a cash subsidy that allowed little assistance for those who may suffer discrimination in the private market. So those could be Māori or Pacifica families, or solo parent households, or mentally ill persons, and so on. So there are these real concerns about accommodation supplement, whether it's doing what it's actually what it was intended to do. And there is a real tension between the freedom to choose where to live and the ability to rent a home. There is actually evidence from the US that some recipients of housing, they've got a housing allowance scheme called housing choice vouchers. And those who receive housing choice vouchers, these vouchers are not actually able to lease up, so to find a home due to discrimination or to tighter housing markets. So there is this kind of tension at the heart of this policy. So therefore, we ask a simple but we think an important question. What is the wellbeing difference between children exposed to accommodation supplement support compared to their non-recipient peers? And the idea here really is that, and this is kind of a preview of our research and findings also, is that if children are exposed to the same neighbourhood, what are the differences in terms of their well-being outcomes? And we find that there are differences, and those differences are significant, and they are potentially related to additional financial constraints that AS families face. So in New Zealand, $2.1 billion is spent on accommodation supplement. This is in 2023. 366,000 recipients receive accommodation supplement, which is 7% of New Zealand's population. Again, this is in December 2023, and 1 in 3 of them are children. What's one of the interesting things about accommodation supplement is that it's the design of it was modeled on the US Section 8 Housing Choice Voucher Program, which allows us to compare the outcomes of our own housing allowance program to the outcomes of the US, where there's a lot more literature and a lot more evidence for how it's working and how it's not working. Speaking of literature, in New Zealand, there is really no literature related to non-housing outcomes of AS receipt, and in particular, no literature studying children's outcomes related to AS receipt. There was a report published by an actuarial firm called Taylor Fry for the Ministry of Housing and Urban Development, but it really made no attempt to compare against alike groups, and the outcome observation period was really short, and it just took 2019 as the year from which it drew its populations. Also the report was kind of not really published in a peer-reviewed academic journal. Internationally, there is actually a moderately sized literature, mostly centered on the US Housing Choice Voucher Program. HCV, Housing Choice Voucher Program effectiveness appears to vary by age, location, and specific outcome measures. But the strongest benefits that they found was for young children relocating to improved neighborhoods. So there were positive positive improvements in math and English scores, fewer health problems and missed school days, and the moving to opportunity experiment. This is a very large randomized control experiment which moved people out of public housing projects and into lower deprivation neighborhoods with the use of housing vouchers. Actually found that test scores improved, earnings improved, and also more families stayed together. So there's some positive findings from that one. And then there's also this experiment in Chicago. Much of the literature in the US is actually based on these these lotteries that they run. One of the differences of the HCV program in the US is that there is a ceiling to their funding. So the funding is limited, and therefore not everyone who applies for the support is able to receive it. So some states have decided to run lotteries. So they're able to have this quite rigorous causal evidence for the effect of housing allowances on outcomes. But in the case of the Chicago housing lottery, they found little effect on a whole range of outcomes: neighborhood, education, crime, and health. In New Zealand, we obviously don't run lotteries, so our evidence is mostly associational. So our study really focuses on children's well-being. It also develops a really closely matched peer group to make sure that we compare against a like population between those who receive accommodation supplement and those who don't. And also we include a wider range of outcomes. So we include mental health, education, and criminal justice interactions as well. We use the IDI data, unsurprisingly. So using the IDI, we follow families who did and did not receive accommodation supplement. And we observe what happened to their children over time from the age of 13 to 18. So this allows us to see the differences in health, education, and police and criminal justice interactions, all tied back to that early exposure to the accommodation supplement. Our identification strategy is we include all children born between 2001 and 2006. We only focus on firstborn children because we think that the larger families with more children, they face higher financial constraints and really more complicated circumstances that may really bias our results. So we focus on firstborn children only. We identify our AS children by the mother receiving the accommodation supplement 12 months before the child's birth. And our control group is constructed similarly by the mother, but by mothers not receiving any government support 12 months before the child's birth. So this includes not receiving any obviously accommodation supplement, but also not being in social housing. We further restrict our sample to mesh blocks with one or two AS recipients. And the reason we do that is because mesh blocks with more AS recipients, the two groups are really, really different. So it makes it really difficult to construct a really similar control group to our AS treatment sample. So we end up with a final sample of 14,000 AS children and over 85,000 non-AS children. The two groups, unsurprisingly, end up looking quite different. So the mothers of the AS children they are younger. They're also have lower incomes, not surprisingly. So this is income 1 year before birth. And also they differ in terms of ethnicity. So AS children are predominantly Maori, non-AS are predominantly European. And there's quite a number of Europeans as well in the AS group, interestingly. They also differ in terms of their deprivation starting point, with the non-AS group living in lower deprivation neighbourhoods, so around a mean of 5, while the AS live in neighbourhoods of deprivation closer to 7. So quite a large difference there. And there's also a higher rate of single mothers as well in the our AS cohort. So we identify that by whether a father is recorded on their birth certificate or not. Empirical approach. So our empirical approach relies on exact matching. So we match on the child's ethnicity, mother's age group, child sex, whether a father is recorded on the birth certificate, deprivation index, and parental income group. So these are the observable characteristics which we use to make sure that the two groups are as similar as possible before we estimate the outcomes. We also calculate weights, and the weights are calculated by 1 over the number of control children for each AS recipient. So, and this is we draw from with replacement out of our control sample. And then we implement weighted least squares regression to estimate our association between AS receipt at birth and outcomes at ages 13 and 18. This is our matched sample summary statistics. You can see that the mean differences here are very, very, very small. So even income, there's a difference of only $400, just over $400. So we achieve a very good matching quality. We end up with our match sample ends up with just over 10,000 AS children and just under 20,000 unique non-AS children. And we have tested the differences between the two groups, and the differences, there weren't any significant differences, unsurprisingly. This is our weighted least squares regression. So we estimate the effect of just a simple regression where we estimate the effect of receiving AS at birth on outcomes, and our model includes our individual level weights as well. In terms of outcomes, so we've got quite a large variety of outcomes in 3 domains. In terms of physical health, we've got 5 outcomes. We measure all hospitalizations for any reason, respiratory hospitalizations, which we think are related to housing quality potentially, and then 3 mental health outcomes: acute hospitalizations, mental health prescriptions, and mental health service use. We then also look at 6 criminal justice outcomes, 4 offending ones and 2 victimization ones. And we break down the offending ones into drug and alcohol assault, theft and burglaries. So quite a granular level of outcomes. And also we look at, in terms of victimizations, we look at family violence specifically. We also look at 6 education outcomes. So we look at school completion overall, and then we look at more granular completion, whether someone has just completed just level 1, 2, or 3 NCEA, and whether they've been suspended by school, and also university entrance. So all our outcomes are binary, and we measure these outcomes between the ages of 13 and 18. As part of the regressions, we cluster our standard errors on the mesh block. So in terms of health, even after matching, the AS children are 1.8 percentage points more likely to be hospitalized for any reason compared to the control group. So this is a significant result, and this is relative to a baseline of 29.8%. So a 6% relative increase in the rate of hospitalization for any reason. Interestingly, the respiratory hospitalizations are not significant. So this possibly indicates that the two groups live in equally poor quality housing. But it was a surprise to us that was negative. Mental health. So we find no meaningful association in acute mental health hospitalizations and no significant increase in the use of medication for mental health conditions. However, we do find that children in the AS group had a 5.2 percentage point higher likelihood of using mental health services compared to our control group, which is a 24% increase relative to the baseline. It's an interesting story in terms of criminal justice. Every single outcome we've looked at has been consistently very significant. So the AS children by age 18 are significantly more likely to have contact with the criminal justice system across all major offence categories. Being on AS is associated with a 2.6% increase in the likelihood of any offending relative to a base rate of 16.5%. So that's a 15.8% relative increase. Similarly, receiving AS at birth increased the likelihood of drug and alcohol offences by 0.9%, assault by 1.1%, and theft and burglary by 1.2%. In terms of victimizations, so children exposed to AS are significantly more likely to be victims of crime, including family violence. In the control group, 17.1% of children experience some form of victimization, and 3.3% of victims are victims of family violence. Receiving AS at birth is associated with a 2.9% increase in the probability of being a victim of any crime. And so that's a 17% relative increase compared to the base rate of 17.1. And AS exposure increases the probability of family violence victimizations by 0.5%, which is a 15% relative increase over the 3.3% baseline. So quite stark results there. Education is another interesting story, and again, a negative one here as well. AS exposure in early life is associated with lower rates of academic achievement and increased risk of school suspensions. AS is associated with an increase in the likelihood of achieving only NCEA level 2 qualification by 1.7% or 4% increase from the baseline. AS is also associated with a substantial decline in the likelihood of completing secondary school qualifications and gaining university entrance. So this is NCEA level 3, a reduction of 6.4%, university entrance attainment 7.5% reduction, school completions 3.8% reduction, and an increase in suspension rate of 3.9%. So all quite negative, really. So why does this happen? So we've got an ongoing piece of work where we're starting to look at the mechanisms why this might be the case. One reason we're exploring is try to understand whether there is a decline in real terms in terms of AS support. And there is also a difference between the composition between the two groups may be different in terms of whether they're renters or homeowners. AS homeowners are also eligible for AS. We from our data, we don't know whether these people are renters or homeowners. Our sample is drawn from 2001 to 2006, and the earliest census that's available in the ODI is from 2013. So it's really difficult for us to know which one, what the composition of renters versus homeowners in both of our groups. There's also could be a difference in terms of housing quality. So we know that there's a relationship between deprivation and housing quality. So as deprivation increases, the quality of homes actually decreases. So there's more mold and there's more dampness in homes in higher deprivations. There could also be housing insecurity. So this is stability of tenure. So more frequent house moves could be associated with poorer non-cognitive educational outcomes. And this is related to also mother's involvement, more frequent moves. There's places higher burdens on parents, and also possibly because they're possibly renters, they have to work increased hours, and therefore they may not be as involved in children's schooling. But overall, there could also be other unobserved factors as well that we are not sure about. So one thing we had a look at is deprivation trajectories. So it is possible that the outcomes that we see are related to a divergence in terms of deprivation between birth and the age of 18. And this graph actually shows that that's true. So on the x-axis, you can see that's ages. I've plotted ages, and on the y, you've got deprivation decile. So by age 1, the two groups, there's already a divergence in terms of their deprivation decile. The AS group already lives in higher deprivation areas, and while both groups actually improve in their deprivation, the gap actually widens somewhat between the ages of 1 and 18. So it's possible that the outcomes that we see are actually related to this divergence in neighborhood deprivation, even though they start in similarly deprived neighborhoods, they end up diverging over time. Obviously, we don't know why that happens, so we're looking into that. But there's definitely a difference in deprivation over time. Just concluding, so there is. As I presented, there's a significant and large negative outcomes associated with beginning life in a family as receiving AS compared to a similar group of peers not receiving any government support at birth. We also find that even if they are similar on all observable characteristics, including neighborhood deprivation, all outcomes are persistently and negatively, significantly negative. And we think that possibly some of the outcomes may be a result of poor quality housing or housing of smaller size than required. But obviously there are other mechanisms as well that we're still investigating. So that's probably it.
Yeah, thanks so much for that, Oliver. I guess that's really, from your perspective, really nice to have the hard data sort of to back up what I'm sure you were already pretty sure of from your work at Cunning, or in terms of those stark differences that you've shown there. People are used to these sessions, so they've done very well putting stuff in the in the chat here. I'll just sort of read through some of those. Len Cook, how many of the variables used in this great IDI-based study actually were collected in the census?
Uh, yeah, I was asked just generally the ones about household that we usually get from the census in terms of household quality, and the ones which are not collected in the IDI itself through an administrative process. Sometimes they're quite important in analyses. And given that yours was about housing, I was wondering about that.
Yeah, absolutely. So a lot of those are collected in the census. And well, the housing quality ones only started to be collected in the 2018 census. So even the censuses before that, they
Right.
didn't have any housing quality information that wasn't being collected. So that's really hard to come by. And for us, because our sample was, from 2001 to 2006, we really couldn't specifically identify whether they were homeowners or renters, or what their housing quality was. So the census was of limited use, really.
Right.
Yeah, for our
Thank
analysis.
you.
Thank
Yeah,
you.
from memory, there was a question on what you use to heat your household, I think, in previous censuses, but that's about it.
That's right. Yes.
Yeah,
Yeah. Yeah.
which is not great. You had another question there, Len, as well. Are you able to quantify place-based differences in the quality of education services available?
I must admit, it's an enthusiasm of mine that the public sector agencies like education fail to really report or measure how there are place-based differences in the quality of education. For example, in different high schools, I know that there are some in the more well-off area might well have, say, all their staff university graduates. And when you get to poorer areas, there are likely to be fewer university graduates or a higher turnover. Do we do anything to measure that?
Not as part of the study at the moment, no. But that's a really interesting suggestion. I think that's probably true and very interesting. Yeah, I'll note that down, and I'll look into it. Yeah, thank you.
I was thinking particularly in terms of science graduates is my bias, but yeah.
Yeah, absolutely. Yeah, cool. Thank you. Thanks, Len.
Leah, how did you separate children of families who own their own homes and receive an
I
accommodation
think
supplement?
Ori already answered this during
Okay,
the end of the presentation, that they aren't able to differentiate between renters
right, yeah.
receiving an AS versus homeowners receiving an AS. Yeah.
That's right. Yeah. There's just to address more on that question. So there is a relationship between deprivation and home ownership versus renting. So as deprivation increases, actually there's less home ownership actually. So if people are living in more highly deprived areas, there's less homeowners actually there. So while we match on deprivation, over time they disperse. So it's probably potentially there is a renter effect there somewhere. So the other thing we're doing is we're looking at as part of the security of tenure work. So we're looking at how many times have people actually moved over the from birth until 18 as well, and that could be a proxy for whether someone is a renter or a homeowner as well. So we actually might be able to address that question with, kill two birds with one stone by looking at, the how many people move actually, how many times people actually move. So yeah, I think that's a key thing about this research where it's really hard. Yeah.
Yeah. Cool. Thank you.
Thank you.
That's a really interesting point. In that regard, you're kind of relying on workarounds to
Yep.
fill in some of the gaps in the data.
Absolutely. Yes. Yeah.
Shanti, did you consider urban-rural differences between the groups, how closely or not they were matched?
Um, Yes, initially we did look at that, and that made very little difference. Like the people actually, the vast majority of people of our sample actually are urban in the urban area. So we did look at it initially, but it actually made very little difference. Yep.
She followed up wondering about policy implications, as not sure if the analysis is considering AS as a correlate of adversity or an intervention to address adversity.
Yeah, this is it's very interesting. Yeah. Um, I think we kind of need to delve into the mechanisms for why why the outcomes are the way they are before we kind of go into policy prescriptions. It's really hard to say, but to me, it seems like the policy prescriptions are kind of more housing market related than actually kind of. I presented this work at a conference, and one of the questions was like, well, what is your conclusion that we should basically scrap accommodation supplement? And really, it's not, obviously, so that's not what I'm suggesting here at all. I'm kind of suggesting that I think there are. I think that there's a whole housing market interventions that need to be made rather than sort of scrapping a policy like this. So if that kind of answers the question.
Yeah, I mean, from your perspective, in terms of the data, in order to do anything like that, you'd have to have a subsequent sample that did not receive but needed to be receiving
Exactly.
or met the criteria but were not receiving, and that you can't really do. So
Yeah.
no, you definitely not concluding that. There's a question, are you planning to publish these results soon? I guess as part of your PhD.
That's right. Yeah. We're actually going to publish it in a journal soon, hopefully. So yes, it will definitely be published. Yes.
My question though was around the what data you actually use to ascertain the mother-child pairing, and then because then that depends too, like on the likelihood that that pair stays together,
Right.
and whether or not you have accounted for that at all or thought about it at all.
I haven't, to be honest, because I didn't realize there would be a possibility that a child could be separated, well, in significant enough numbers to have an effect. But is that a possibility? I'm not sure if that's. I mean,
well, it might be small.
Yeah.
How did you determine the maternal child pairing?
So DIA data and whether so mother parent one is the mother and children, a child associated with parent one, basically in the birth data set in the ODI. Yeah.
Right.
So
I think that would have to be a limitation that you discuss. But yeah.
Right. Okay, that's interesting. What out of interest, like what could so the separation between mother and child, like what could be the reason for that?
Well, if they get adopted or if they get removed from care.
Yeah.
Or I guess you can be very clear that your results are for a mother-child pairing, like the mother's thing at birth, which you have said, but that might not necessarily reflect the environment that the child necessarily stays in.
Okay, interesting. Okay, cool. Yep, thank you.
And that's possibly where census might be helpful too, because that can ascertain like at least household groupings, I guess. And I know other people have done work in the IDI looking at family relationships. So yeah.
Okay, awesome. I will have a look at that. Yep. Thank you. Thanks.
No worries. Interesting work though.
Riona says you discussed mother income 12 months preceding birth as a factor used to compare similar families. Was the overall family income taken into account?
Sorry, that's actually not mother's income. That's overall family income. So this is income for both parents 12 months before. But obviously, if there's no father listed on the birth certificate, then it would be just mother. And the AS children have a higher rate of single parent families. So yes, it's both parents actually. But yes, there would be a difference for sure.
Thanks, Ollie. I really enjoyed that. Bring together so many of things that I'm interested in one presentation. Always makes me happy. My question's also on income, and you've got these two groups that you're comparing with same household income. Is that comparing, is the AS included in that income? So are you including it's the same income and then they get AS on top of that?
Correct. Yes. Yep.
Okay.
Right. AS is not included. Yeah.
Okay. So you're comparing those. So then I'm wondering why, if considering AS is mostly an income sort of criteria, as I understand it, why those families that are on the same income, they're not receiving it, other than maybe they're not paying for accommodation and therefore are getting free accommodation somehow.
That's right. Yeah.
So is that kind of have I got the right train of thought here?
You have.
Okay.
Yeah, there is some, and there's been a constant kind of like thought in our mind throughout this research, kind of, if we are comparing like people, and people are eligible to receive accommodation supplement, why aren't they receiving it? And I think there could be a self-selection. There could be some self-selection into receiving accommodation supplement, and our thought could be that also that this could be a really kind of almost people who are really, really in a adverse kind of financial situation could be self-selecting into the receipt, and actually the outcomes would actually be a lot worse if they hadn't been receiving accommodation supplement, right? So they could be, that could be one reason for sure. So yeah.
I'm also wondering other financial support that's come in if you're only measuring from the birth father, because there's a lot of transitions that will happen, particularly in these lower income groups. So there might be partner support from someone within the family for a higher household income that's not on the birth certificate.
Yes, absolutely.
Those dynamics going.
And it's really hard, like construction of a household in the IDI is just so complicated. So it's really hard because so we also look at the income. One of the mechanisms we're actually looking at is like income trajectories as well. So over time. And what we do is we look at whether the parents still live at the same address for over time from birth until 18. So, and how the income actually changes over time as well between the two groups. I don't have this data available at the moment, but that's what we're looking at as well. So,
yeah.
But again,
I'll be super curious as a comparison with public housing as well. But also, it just seems strange to me because a lot of my research has been on the effect of income on families. That in many ways, an AS is just a boost to the family income.
Yeah.
And you're seeing the absolute opposite to what you'd expect when you boost incomes. So anyway.
Yeah.
Keen to keep talking.
Yeah, sounds good. Yeah. Cool. Thank you. Thanks, Jamie.
Yeah, that's an interesting thing to think about. It just makes me think that maybe the longitudinal census product would have been a useful way to look at this as well, except for the fact that you can't get that sort of information out of it. It wouldn't have the benefit receipt. Well, the census does list sources of income, but it might not be that specific. I can't quite remember in those earlier years because that, of course, went back in time further.
Yeah.
We're gonna go Sharan.
Thank you very much, Ollie, for the lovely presentation. I'm interested in knowing whether, I can see that AS recipients are still worse off in terms of all the outcomes. Was there any studies that was done previously for the outcomes, similar sort of outcomes for those under social housing group?
Well, Jamie's done has done one study, and yes, there's been a bit of work actually on social housing for in terms of health outcomes. Philippa Howden Chapman's done a lot of work on that of social housing outcomes of social housing in terms of health. The Social Investment Agency have done a piece of work as well on social housing, comparing outcomes. I think across quite a lot of domains. But yeah, there's not a lot in this kind of quite a broad social housing literature outcomes for in particular children. So it's one of the things I'm also kind of one of my other papers we're looking at is we're looking at outcomes of social housing, in particular kind of some of these moves, people relocating to different neighborhoods as well. So yeah, the literature is very, very small in New Zealand.
So, Oli, would you say that the purpose of the AS, so it didn't serve the purpose and it wasn't useful?
No. So we're not saying that at all. So our work is really not causal. It's associational. So it's so we're not delving at the causal outcome. So absolutely no, we can't say that at all. Yeah, there could be other things going on that we're just not seeing in the data, or we're just not measuring. Right. So
thank you.
Yeah. Thank you.
Jamie's just posted a link to the social work on social housing and child wellbeing that you mentioned, and Anna has posted a link to the States New Zealand Administrative Population Census on with familial relationships. Li Feng says AS is treated as part of the social determinants. The research matched children by deprivation, which is useful. It could be very challenging to separate the effect of AS from other related social economic things. They may just be complicated or entangled.
Yeah, I mean, again, you're getting into kind of unobserved features. So we don't really know. We try to control for as much as possible, but yeah, there's probably things we are not taking into account. Yeah.
Yeah, and as you say about the, I mean, the benefit system in general is that people have to know what they're entitled to, and
yeah,
there is definitely an educational thing going on there where people, mothers who are highly educated and just know what they're entitled to will go and seek it. The system's not going to come to you, so
yes, yeah,
it's all very entangled, to use that same word.
absolutely. And having worked in public service as well, I know how complicated it is for people to apply for what they're kind of eligible for as well. So the system makes it really complicated to apply for these things. So there could be potentially that as well. Yeah.
Thank you again for sharing that research with us today, and I'll be in touch with everyone